Welcome. I'm Lee Doherty Biddison.
And I'm Carolyn Kamsty-Fowler, and we're your co-hosts for the Johns Hopkins Office of Wellbeing's podcast, Vital Conversations, Influencing Workplace Wellbeing in Healthcare.
We spend a lot of time thinking about how to influence workplace well-being in healthcare, and we're excited to share what we're learning.
Thank you for joining us.
Hello and welcome. Today we are joined by Dr. Richard Safir, who is our colleague in the Office of Wellbeing. Rich is the Chief Medical Director of Employee Health and Wellbeing for Johns Hopkins Medicine, where he leads the Healthy at Hopkins Employee and Wellbeing Strategy. He's also the author of A Cure for the Common Company, a well-being prescription for a happier, healthier, and more resilient workplace. But as people who work closely with Rich, we greatly appreciate not only his commitment to building a workplace culture that supports well-being, but his commitment to living this lifestyle too. So welcome, Rich.
Thanks for having me. Good to see you again.
Rich, so excited to have you on the podcast today. I get to ask the first question. And that is, you've been in this business, as we say, employee health and well-being for quite a while now. How did you come to focus on workplace culture and make that really central to all your efforts?
Yeah, it's not what I thought I'd be doing when I went to medical school. I trained in family medicine. And after a year of practice and realizing, boy, it's pretty hard to make a big difference in 15-minute visits, I knew I had to go a different direction. So in my second job at George Washington University on faculty, I was reading a paper about Johnson & Johnson, the company, and what they were doing to help increase physical fitness for their employees. And that got me interested, and I kept reading other journal articles, ultimately coming to the conclusion that I could make a big difference on or for thousands of people at a time. And so that started my journey to ultimately Johns Hopkins.
So Rich, as you think about culture and how you influence culture, do you think of organizations as having one culture, or are there many cultures nested within one place?
Oh, there are definitely many different cultures across an organization. So a culture is the shared behaviors, beliefs, and attitudes of a group of people. And so when most people think about culture, they think, hey, I'm about to travel to another country. And they think about that culture in that country, like what are their foods? What is their music like? Do they have special dancing? But culture doesn't have to be just defined by geography. It's also defined by a company per se. So everybody within an organization shares many different cultural aspects. Now, within an organization, there can be multiple cultures. Sometimes they're defined based on department. So here at Johns Hopkins Medicine, right, there's a nursing department that may have a different culture than the accounting department. So it can be based on department, but it could also be based on other attributes that aren't defined by the organization. For example, some organizations, they create special interest groups. So if you want to find other employees who also like to go bowling, you might have that group with a shared interest. And now and then this bowling group has their own culture. So it's hard to address every culture, but when you look at the culture that goes across the organization and then give the leaders within each area the tools to shape their own culture on their teams, you stand a much greater chance of making a positive impact.
There's this question about navigating and managing multiple cultures at the same time is such an interesting one. If you had, someone coming to you saying, I want to set up a program, Rich, and how am I going to think about and understand these cultures and sort of address that? What would you say?
Well, it's interesting, Lee, as we, the three of us, share this privilege of leading the Office of Wellbeing, we ourselves are a case study in how our cultures or the groups that we support overlap. So we have a culture across Johns Hopkins Medicine, And then we have a physician culture and we have a nurse culture. And we also have a food services culture. So depending on the program, we have to make some adjustments. And we might not even have the same program for every subculture. So for example, let's just take a look at food, okay? So on one hand, we have clinicians who might take call and be in the hospital for an extended period of time. And we would want to make accommodations to help them. They have this culture of long hours for whatever interval that is. And then we have other subcultures who may live in neighborhoods where they don't have access to large grocery stores with fresh produce. So we may want to make accommodations to allow them the opportunity to maybe shop on our physical campus so that they can go home with those fresh fruits and vegetables. That's the kind of thinking. It's all in the category of food, but there's these
Different
nuances
for
that
these different experiences. Yeah. Very interesting.
Carolyn, what subcultures of the nursing population do you think are different than the let's just say the physician population? This is not rehearsed for the audience, so we may have a pause for a second. It's something that we grasp with a lot, but we don't usually talk in the context of cultures.
Well, Rich, as I think about that, I hesitate to give you the traditional answer, which would be generational or certain specialties. I tend to think about the subcultures in terms of where are they in their lives and what are the other challenges that they're facing. So for people who are in management and leadership roles, although they officially work a certain number of hours a week, that is essentially a 24/7, 365 expectation for many of them.
Yeah.
Then you have people who are later in their careers, pretty well established, but they maybe have elderly parents. They're trying to deal with kids in college. We have many of our younger colleagues coming in, dealing with graduate school and children. And so each of these has as different, and there are the different generational issues in terms of whether we're primarily digital or not. And so I think that idea of work being work and home being work, home being home is irrelevant. Is irrelevant now. We have to be asking the question, what shapes your culture, your work culture, but also what shapes your broader experience in life?
Yeah.
And what's possible for you in terms of looking at well-being.
I like that you brought up this generation idea because look, if you have a subculture within your workforce that has children, small children at home, then perhaps the best well-being strategy for them is giving them greater flexibility in their work hours. Whereas, that may not be the case for people who either don't have children or who are empty nesters. So we definitely, well-being in the workplace is pretty complicated, but the more we can nuance our approach, the more likely we are to help our employees feel as if they're supported. And we know that when employees feel that they're cared for by their employer, it not only boosts their well-being, but it also boosts their engagement, and they're more likely to stay with that employer.
I love this area we're going into because I think it's so important. I know in thinking about, how we impact well-being at Johns Hopkins, I have, often gotten caught in the trap of what are the one or two big things we can do that will make a difference? What is it? What's the thing that if we can crack that nut, we'll get there? And the answer is all the things. And I think to your point, Rich, and maybe you can unpack this for us a little bit more, that really is, a multi-pronged strategy and multi-pronged approach to try to beat these different constituencies in the spaces where they find themselves.
Yeah, I when I get asked that question, Lee, I'm always like, oh gosh, this is the hardest question. So I actually have 3 different answers that I use for different audiences. So it's a rotating, one answer. So earlier this week, I met with our chief financial officers across Johns Hopkins Medicine, and the answer to them was one meaningful conversation with each of the persons who report to them each week. And a meaningful conversation would be between 10 and 15 minutes. And the meaningful conversation would be of the context where the manager makes a connection with the employee beyond the deliverable. So it might be a conversation that includes what that individual did well. It might be a conversation that includes some acknowledgement of the strength that that person brings to the team and Johns Hopkins Medicine. It might be a conversation that includes growth opportunities, something that helps the individual feel as if their manager is listening and cared for. That boosts well-being. So that was my one answer. I'll very quickly, I'll give you the other two answers. So sometimes depending on the audience, my one answer is breathe, because most people are kind of like stressed during the workday and they're running around too fast. And if people could just slow down long enough to take a good deep breath, which I just did, which amazingly still surprises me that how much that's helpful, that would not only improve that individual's well-being, but we're better to be around when we're less stressed. And the third one answer is put well-being on your team agenda. If you have a standing team meeting and you have well-being as a standing item, that means you will regularly return to that item. And each time that you are approaching that meeting date, then you will prepare for what it is within the category of well-being will you be discussing or sharing with your team. And that's going to keep you on track to growing that well-being culture for the people who are most immediate to you in the workplace.
I love that. So right there are 3 different strategies for potentially 3 different cultures. That's awesome.
Yeah.
Very cool.
Yeah.
Well, I'd love to ask you a question about norms. So this whole concept of norms has come up a lot in our internal conversations around transforming culture, but that may not be a term that's familiar to some of our listeners. Can you talk a little bit about what norms are and why they're important in this space?
Yeah. This is definitely something that doesn't get enough airtime in the well-being community. So norms are the expected behaviors, expected and accepted. So when you go into a workplace, there's certain expectations. So right now, the expectation in 2024 is that you do not smoke inside your work building. And that is a norm. We don't think of it that way. We think of it as like, of course you don't do that. But, different industries and different workplaces have more nuanced approaches. So in healthcare, one of the norms is that before you go to see a patient, you will wash your hands. That is a norm. It's not only expected, it's also accepted. It's what we expect that we're going to see. And if you don't practice that norm, someone will probably call you out and say, hey, I think you forgot to wash your hands as you're going into the patient room. But those are not often, so let's talk about the more subtle ones that don't really come with rules or the institution from behind. For example, lunchtime. Most employers have some type of benefit where the employee has a written policy about how long is the lunch break. And that's great. That's a nice start. But there is a difference between what's supposed to happen and what does happen. And for many workers, the norm on their team is to just work through lunch or to maybe eat lunch, but you're on your computer or you're doing medical records while you're eating lunch. And those norms can make it really challenging if you're the one person who wants to take that break. And let me tell you how this looks. Imagine it's your first day of work and it's 11:45 in the morning and you're like, hey, I wonder where everyone's going to go eat lunch. And no one's moving. And 12 o'clock comes around, you're like, no one's moving still. Maybe they eat at 12:30. And so 12:30 comes around and you're still not seeing people break, but you have started to notice that on one person's workstation, there's a bite out of a sandwich, and on another person's workstation, there's a bowl with a fork in it, and some of the salad looks like it's gone. And so all of a sudden, you start to realize, hey, people are eating while they work. Do I want to be the new person on the team who just leaves? Or and the potential that people think that I'm a slacker, that I'm not going to hold my weight. It puts an enormous amount of pressure for an individual to make the choice that's healthy for them versus what they perceive as the expectation of their team on them. That's the power of norms.
Well, and Rich, as I hear you talk, I'm thinking about the norms that we have that really sort of contradict what we know to be correct, or what we know
Mm-hmm.
is desirable.
Yeah.
So this idea of it's normal to self-sacrifice. It's normal to not eat. It's normal to not drink water in case you can't get away, that kind of thing.
Yeah.
So that brings me to a question, which would be about how then do our colleagues or our fellow employees support our healthy lifestyle behaviors or support these healthy norms in our workplaces?
So sometimes sometimes it's easy to see how people support our healthy behaviors through norms, because just as easily can you be in a work team where the norm is unhealthy, like not taking a lunch break. If it's your first day of work and three of your teammates come over to you at 11:59 and say, hey, we like to take a walk for the first 15 minutes of our lunch break. Would you want to go with us? All of a sudden, you're now drawn into this healthy behavior. But most of the time, things aren't so obvious. First of all, we're usually not thinking about norms. But I would ask our listeners to just kind of pause and ask themselves, what healthy behaviors am I trying to build? And how does the team I work amongst either support that healthy behavior or actually make it more difficult for me to achieve that healthy behavior? And then make a decision. If you recognize the forces that are either working for you or against you, you're more likely to make a conscious decision now that you understand what's influencing you. You're more likely to make the conscious decision. You know what? I am going to go eat lunch, even though nobody else is leaving their workstation. And if someone asks me later, I can just, feel confident that I thought through this and this is the right thing to do. Carolyn, I would strongly suggest that teams and teammates start to have these discussions, because we do not live in a vacuum. We're all impacted by the health and well-being of those around us. And if we really want to achieve healthier habits during the workday, we're going to need to do that with one or more other people. Do either of you have a story or have acknowledged, like, hey, this is a healthy habit I've been trying to work on, and it's working because of a coworker, or hey, it's not working so great because of these other influences?
Well, there's one that I think we're getting better at in our office, Rich, and that is not scheduling 1-hour meetings. It's 50 minutes or
Yes.
5-minute meetings.
Yeah.
We acknowledge that we have biological needs or just simply the need to stretch. And as we're recording, our listeners can't see it, but I'm looking at Lee's bike behind her, and I have my weights here.
Yeah.
And we sort of support each other in trying to be active. But Lee, do you have something?
Well, I love all the things that you've mentioned. I also think, one of the things that we have done in the past is support or stock the wellness carts, and have tried to be really focused on being sure we choose healthy snacks. But what that means is there are also healthy snacks around the office that promote good choices, because we make them together. The other thing, Rich, I was just going to say, as I was thinking as you were talking about when we first started working together as part of the office, your team had outside of their offices or cubicles a little note of, here's something I'm working on, help me. Yeah. And I think that other piece of putting ourselves out there and sometimes we don't like to do that because we want to be seen as having it together. but putting ourselves out there to say, this is what I'm working on. Would you help me, please, in some very simple way to do that? Ask me if I went for a walk, encourage me to do whatever.
So I see a theme through each of those examples, and that is, hey, how can we make it easier to make a healthier choice? A specific call out to operational changes. So Carolyn mentioned the 50-minute meeting instead of the hour meeting. That's very rarely thought of as a well-being strategy by most people, but boy, how important is that so that we're not rushing from one thing to the next? So would be great if the folks listening to this podcast not only thought about what operational changes they could make to support well-being, but if you've already made some, maybe you could write in the comment box where this is posted what you're doing now so that other listeners can get a better idea.
I love that idea.
And Rich, as we were talking again, I was thinking about the importance of environmental cues or environmental support. So when you mentioned hand hygiene, requiring people to wash their hands, we didn't just lecture them about it. We put the hand sanitizer up. We thought about the positioning of our sinks. We made it easy to wash your hands correctly in the care environment. And similarly, we've been fortunate enough in our space to be able to bring some exercise, more limited exercise support into our workspace. So then how does changing the environment or providing environmental cues make it easier for somebody to stick with well-being behaviors or even well-being practices, not necessarily behaviors?
So environmental cues are one of a dozen different, what I call culture connection points. A culture connection point is any nudge that the employer can influence, put in place, that makes it easier for an individual to either make a healthier choice or have a more positive emotion. And an environmental cue is one of those culture connection points. And so, Carolyn, yes, having the hand sanitizer available, having the signs, having a arrow pointing towards the stairwell, which is a nudge to take the stairs. These are all cues that just make it easier. So we have to remember, by the time we get into the workforce, we're usually full-time workforce, we're usually at least 18 years of age. And so we've had 18 years to develop habits. And by that time, it could be challenging to change your habits. So anything that we can do to make it easier for the default to be the healthy choice, we've just lowered the barrier for an individual to develop a new healthy habit. Now, some of that is driven by the employer, but we've mentioned a little bit about having exercise equipment, and each of you have purchased your own exercise equipment that fits in your work area. But you may not have done that had you not had the support of your coworkers. Like, we have made it an acceptable conversation amongst us, right? And if one of us is engaging in some physical movement during a Zoom call, we're okay with that. We're accepting of that. Not every team has gotten to that point. So, Carolyn, I would say that environmental cues are great, and they work even better when they're part of a team discussion about norms. Okay, so here we have these two different parts of the culture overlapping. We just previously talked about norms, and now we're talking about environmental cues, which is an example of a culture connection point. So if we can get teams to start talking about what healthy norm they're trying to achieve, and then give them ideas of what environmental cues and other connection points they can put in place to make those norms come to life, then we'd really be accelerating our path towards a healthier workplace.
And that reminds me of our conversations both in the office and other podcasts that Lee and I have done, where we talk again and again about the importance of social support and social connection.
Yeah, so we've talked about norms, and we haven't yet talked about peer support. I'm not sure how much time we have, but just a quick note there's one thing to be amongst a large group and be talking about norms. It's another thing to be working with one other person, a peer, and how they can either help or harm our health and well-being. Maybe that's another episode, but if the listeners haven't thought about a peer support strategy, I strongly recommend you do a little reading and think about how you can integrate that into your well-being culture plan.
So we've talked about peers and coworkers. Yeah. Maybe, Rich, if you could comment on a role of leaders in this space, but the manager, the leader, the boss, we all have a different name for that person we report to.
Yeah.
But what their role is in this space.
So I subscribe to a model of shaping the workplace well-being culture with 6 building blocks. And we've already mentioned 3 of them: norms, culture connection points, and peer support. A 4th is leadership engagement. It's not the same as leadership support. It's one thing for a leader to say they support what you're doing. It's another thing for a leader to be engaged, and that is an entirely other conversation that could be that is the topic of symposiums and conferences.
We'll definitely have to return to that.
Right. So, Rich, our time is winding up, and I'm no doubt we'll be back and talking with you again. But I'd like to give you an opportunity to have the last word. If you wanted to tell our listeners anything you could about influencing workplace culture, what would it be?
So this is a variation of you could just do one thing.
No, not one thing necessarily.
I know. I just think what I'd like the listener to take away from today is that a well-being strategy in the workplace has to be more than benefits and programs. We really need to be thinking about culture in its entirety. If you're not comfortable with the word culture or well-being culture, I strongly suggest you read about it, because there are plenty of commercial enterprises, companies that want to sell you something that has the name culture in it. You don't want to be duped. What we're promoting here shouldn't be costing you a ton of money. Peer support, norms, these things are free. We just have to know how to leverage these social sciences. So I guess the takeaway, Carolyn, is I hope our listeners will want to learn more about how to build a well-being culture on their team and across their workplace.
Rich, it's been delightful to talk to you today.
It's been great.
Thanks for being here, Rich.
Yeah.
So that's it for today. If you enjoyed what you heard, please share this podcast with a colleague. And as always, we welcome your feedback.
If there are any topics you'd like to hear about, please email us at owb@jhmi.edu.